Good afternoon. Good afternoon. Glad everybody is here joining us. Happy Friday to everyone who's able to tune in today. It's a great afternoon, certainly. I hope that you all are enjoying the day and able to kind of get outside a little bit. There's been a lot happening this week, and we'll get to some of that. But I want to first start off by congratulating one of the homeboys from Robert E. Lee, who was drafted last night in the NFL draft in the first round, first wide receiver taken, Henry Ruggs. Want to give he and his family a big shout out and congratulations for all the hard work that they've done over the years, both on the field and off the field and in the classroom, paying off as it did for so many other young men. But we only had one that was from the city of Montgomery last night, and that's who we want to really give some shine to. I thought it was great that he had the partnership with the Old Spice robe and everything, highlighting some of the work that the NFL is doing with the United Way during this pandemic. And so just really want to congratulate him and wish him well, wish his family well, much success, that we'll be cheering him on from right here in Montgomery as he goes out to be a part of the Las Vegas Raiders. I got to get used to saying that. I'm used to saying Oakland after saying LA for so long. So now I got to get used to Las Vegas. So it should be fun to see him line up in the silver and black in Raider Nation. So again, congratulations. And look, congratulations to all the young men. I mean, I think there were a lot of winners last night, but I guess the SEC probably had to be the biggest winner in that. I was hoping that either Henry or Jerry Jeudy would fall to my Dallas Cowboys at 17, but I'm glad they went higher than that because that means more money for their contracts versus what they would have got at the 17th pick with the Cowboys. But we'll take CeeDee Lamb too, even though he's not a Crimson Tide wide receiver. But a lot of winners. The SEC having about 15 guys drafted yesterday. I thought was great. Obviously, LSU I think had 5, and Alabama had 4. Auburn had 2. Georgia had 2. So had a lot of SEC talent represented there, and again, a lot of work that most people don't see those athletes put in outside of what they see on game day that goes in Monday through Saturdays on the field and off, but in particular in the classroom. So again, just hats off to all of them. I know there's been a lot of talk about reopening the economy, and I know that there have been a lot of questions that I've been getting about when we're going to get there. When are we going to get back to normal? You've got the NFL draft. This will normally be right around the time of the NBA playoffs, baseball, minor league, biscuits, Major League Baseball. There's so much that we're used to having kind of as a calendar that we don't have as a barometer of where we are. But I do want to say that, we're all looking forward to getting the economy back open, but it's not open yet. So as you can probably tell from my haircut or the lack thereof, barbershops should not be open, not even mine. Beauty salons are not open, or should not be open. Tattoo parlors, and any of those places where people are getting together in big groups are places that should still be closed at this time. We're all looking forward to getting the economy back going. Again, the city runs off of the taxes that you pay and the taxes that businesses pay for their licenses. That's how we fund the services. That's how we fund the government. So no one is looking forward to that any more than I am. But we have to do it in a responsible manner. And that means making sure that we're cautious and deliberate about it. And we're going about it in a step-by-step process. And so for me, that means getting to a point where I feel comfortable really talking to not only business owners, but healthcare experts about where things stand right now based on the information that we have not only here in Montgomery or in Alabama, but in most parts of the nation. There's a feeling among the health experts that the economy is not ready to reopen in full, and that we've only gotten to this place of seeing some of the numbers start to level off because we have followed these social distancing practices, and no one wants to kind of end them prematurely. Now, that said, I do believe that we will be getting to a point real soon where the economy will be open, and I think we'll open in some phases And there may be some places that open up earlier than others. There may be some cities that open up earlier than others. But we have to take that on a case-by-case basis. Right now, Montgomery, we've only tested less than 1% of the population. So we aren't at a number where I feel like we can really draw on an accurate sample size to really determine that. We have free testing centers available right now, Walmart on Atlanta Highway, that we want to encourage anyone who thinks that they are suffering from these symptoms to go and get a test so that they know their status and they know whether or not they can be spreading this to one person or the next, whether that be friend or family or neighbor. But we also want to make sure that we get more people to get tested so we can learn more about the virus itself. And so even if you think that you've had some symptoms, with Hyundai giving us 10,000 test kits, we want you to get tested if you feel like you have some of those symptoms, or you feel like you feel them coming back on, because we now know that people can see the symptoms reappear. And that's also going into the process of when we decide to reopen. And as a city, we want to make sure we're thinking of things from a community standpoint where that's concerned. Now, before I get too far into the weeds on the coronavirus and the reopening, I want to make sure that you know that we're recognizing our frontline heroes here in the city of Montgomery. And we're doing that. We're asking you to go to www.montgomeryal.gov to submit any people that you think are community heroes or frontline heroes who are doing extraordinary things during this time to really help out and assist the community. Right now, we want to honor James Amos, and we want to honor him because of the work that he's been doing with the brown bag bus and the YMCA. And they're taking lunches all around the city to different neighborhoods to make sure kids are getting fed and they're getting the necessary food allocations that they should, regardless of where they may live, or regardless if they have transportation to get to another site. And so the Brown Bag Bus Initiative is one that Gary Cobbs and Montgomery area YMCA have been spearheading, and James has been doing a fantastic job really taking the lead on that and really driving that, pardon the pun, really forward for the YMCA here. And so, James, we just want to say thank you for the work that you've done. We want to say thank you for everything that you continue to do and you've been doing before, and I'm sure you'll do after this. But we want to recognize you as our first frontline hero. And as we get back to a regular pattern of things, we'll be recognizing all of our frontline heroes. And again, these are people that you nominate. These are people that you see doing tremendous things in the city. And so I didn't want to get too far in the weeds of all the policy making decisions that we have to do without recognizing those people who are making a difference day in and day out. And, I want to kind of touch back on a couple of quick things before we go to our guest for today. And it goes back to really how we're going to proceed as a community during these remaining days or weeks. What we're being told right now is that our cities, our states, and our communities are seeing, again, better results, but that is due to the practices and the responsibility that many of you have undertaken. You all have been very disciplined in this approach. We know it has not been easy because here in Alabama, in Montgomery, this is the best time of year. It's blue skies without the sweltering heat, without the high humidity. So you can get out and do different things, but you all been doing that in a very responsible way. Sure, we've had a few outliers there. We've had a few people who want to buck the rules. But by and large, everyone has been doing this in the spirit of cooperation and collaboration that is really important. But we want to make sure that we continue to social distance with one another, and we continue to wear masks in public, whether that's just a handkerchief or if you have a reusable mask now. We want you to wear a mask to continue this behavior because we believe that's going to help us in the long term. And again, some of the information that we're getting, whether it's through conference calls we're having with various organizations and health outlets, is that this is going to be with us for a little while. We're going to have to deal with the comings and goings of this for at least another year. So we're going to have to adjust to a different type of normalcy than we've been used to. And that means, again, doing the things that we talked about when this first started, which is washing our hands, covering our cough, practicing social distancing, and making sure that we are wearing masks going forward. Now, I'm not going to try to mandate you wear a mask, but I want to strongly encourage you to do just that, because I believe it's very important to us stopping the spread. And I think it's going to be very important that we adapt this behavior going forward, as many of the epidemiologists and health experts predict that we'll have a second wave of this in the fall. So with that said, I want to now turn to Sonya Wilson, who's Alabama Reading Initiative specialist, and she is someone who wants to is going to give us some advice on how we can really do better with distance learning and learning at home, which my wife Tamika has been doing for us, and been doing a great job, along with grandparents and in-laws and everybody else kind of in that village helping out with our kids. But many of you are doing it by yourselves, and many of you are doing it day in and day out, while the rest of us are just in amazement of how you get it done. So Sonya, I'm going to turn this over to you and allow you to really talk to our audience about some steps they can take and some tools they can use to be effective in what we're doing with our education and what we're doing with our young people.
Okay, good afternoon, Mary. I'm so happy to be here today. I'm excited at this point in time about being a part of education. Montgomery Public Schools has done an awesome job of coming together to create a plan for our students as well as our parents to help alleviate some of the stress that you may be feeling at this point when it comes to distance learning. We have what we call an academic plan that was put in place on April the 6th in response to COVID-19. Our LEA brought all of our departments together. They all came up with strategies of how we're going to support our students, whether it was paper and pencil or online learning. We also pulled in child nutrition to provide meals for our students so that there wouldn't be any disruption in the daily nutrition of our students. One of the things, and not only that, we even have patrol ladies that have been working to make sure that our students get the things that they need. So one of the things that we do, because I am a part of the Alabama Reading Initiative, but I am based at Danley Elementary, and some things that we do as we've done in other schools. First of all, we have continued professional development for our teachers to make sure that we are providing the latest research-based instructional strategies for our students. Having said that, our teachers each day create a schedule, and in that schedule, there is time allotted for recording of lessons. We also have individual tutoring sessions if the students are in need of. We have lessons that are designed specifically for our resource students as well as for our gifted students. One of the things that our parents can do to help support their children and again alleviate some of the stress that this is causing them at this time is to create a schedule, a daily schedule that mirrors very closely to the schedule that the students have at school. It is very important. I think that the students should be a part of developing that schedule because they remember what they did day to day in their teacher's classroom. So they're going to keep you on the right path when it comes to that. However, in this schedule, what you want to do is make sure that you provide times for what we like to call brain breaks or just breaks. These are activities that give the child a break from the instruction, give them also it gives them an opportunity to process what they are learning or what they're having to work on to turn into their teachers. The activities, the packets that were sent home will be graded. So it's important that the students get these done, or if they're struggling to complete the activities, they need to get in touch with their teachers. The teachers, again, have created schedules. We are monitoring daily our online activity with our students. So if there's a student that types in a question that says, I need assistance with this, you have someone that's going to respond to you immediately. We also have what we call social emotional things that were done to support our students. Our MPS counselors got together and they created videos that our parents have access to online. And again, if you have questions, you can still contact your child's school or your child's school counselor to support you, because we all know how important it is to have healthy social and emotional things going on in the life of a child at this time. We have outside organizations that have reached out to the children that they were servicing, organizations such as Fortitude Academy. They have created online things that the students that they were servicing can access to help them. So at Downey Elementary, my principal, Mr. Brooks, gave me permission to create what we call PSAs. And these public service announcements are just little tips that the students can do each day. So again, it starts with number 1, creating a schedule. Number 2, taking breaks. Number 3 is real big. It is scheduling your meals. Now, I don't know about the rest of you, but my refrigerator now has a sign that says you've been here, go away. We have to keep our children on schedule with their eating. You know, whatever time they ate lunch at school, or if you need to adjust it a little bit to fit your schedule, because many of us are still working at home, then do that. Keep snacks to a minimum, but keep your meals and your snacks healthy. That way your child will have energy throughout the day to complete all the tasks they need to complete. The next thing on this PSA, we need to provide time for play. Playing is learning. Put aside for some physical education activities, adhering to what the mayor mentioned earlier about the social distancing. You can go in your backyard. You can go find a walking trail that's not too crowded. Wear your mask. You know, get your body moving, exercise your lungs, all of those things. And our children are very creative. So incorporate visual arts. Let them draw pictures. Get sidewalk chalk. Let them use watercolor paints. Anything that they can release their creativity. They may want to make something, paper mache, whatever it is you have available to you. You can also contact your child's school. We will assist you in providing some of these things for the students. Reading. Reading is something we've been talking about for years and years and years and years. But in order to be a great reader, you have to read. Listen to your child read to you. Then turn around and read your child your favorite book. Favorite magazine. Let them read all day long. Labels on the back of cereal boxes, things of that nature. Make sure they're reading. And then as they read, ask them questions. You know, who are the characters? Where is this taking place? And once you ask your children these questions, let them respond to you in complete sentences. We know that research is telling us that oral vocabulary is something that's very, very important. So make sure that you're giving them an opportunity to respond to the questions that you ask. Whatever you do, don't get frustrated with your child. If you're to the point that you can't get it done, that's what your school is here for.
Thank you so much for that helpful information. Is there anything else, that we should keep in mind as we're trying to work with our kids, or we're just trying to adjust and adapt to where things are in the educational space? Is it something we kind of have to get used to, in your opinion, or are there things that we can do to be more effective that you may not have mentioned just yet?
Well, two final tips. I'm going to encourage parents to become more familiar with technology, because this is not over, as you said earlier, and be patient. This is a work in progress, and we have all the entities that we have available to us, even the partnership that you created with the Wi-Fi buses. So as more resources are available to us here at MPS, we're going to share with the parents. But if all else fails, call your teacher, go to the MPS website, and we will provide you with the support that you need.
Ms. Wilson, we thank you so much for offering up those tips and suggestions, and really appreciate all the work that you do at Danley. I look forward to getting back out there, read across America next year, and always enjoy the great work that you all do with our kids, not only at Danley, but across our entire system at MPS.
Thank you so much.
Thank you.
All right.
Well, listen, now we're going to take the time to kind of get into some questions, and we'll see what you all are sending in and what you're interested in, and I'll try to address those as well as I can. Let's see what's the first question that we have. Are there any testing sites in West Montgomery? HSI is going to be opening up, Health Services Incorporated, HSI, will be opening up some test sites in Montgomery. And I do believe one of those sites is what's considered West Montgomery. Those will be rolled out probably over the next couple of weeks in conjunction with our test kits that we received from Hyundai. And so once we have that finalized, I'll make sure not only do we share that on our mgmready.com website and social media, but we'll also do a formal press release, and I'll be sure to bring that up in our next Facebook town hall, as we should have that by next Friday, and we'll know kind of what those dates are going to be on the incoming test that we'll have via the support that Hyundai gave us. Will the 1 million tests be distributed throughout the entire state, and when are the tests expected to arrive and begin? Well, I don't know that we have 1 million tests. If so, that's news to me. That would be good if we had half of that many. But we do have 10,000 tests that we received, again, via Hyundai, and we're working out the details right now with the test lab, how we're going to get those tests to them, and finalizing the test site so that we can be geographically centered throughout this community and Central Alabama. Because one of the things we wanted to make sure we did in our partnership with Hyundai was we didn't just do it for Montgomery, we wanted to do it for the Black Belt and Central Alabama, and in particular some of those communities that don't have access or efficient access to high quality testing. So we should have all of those details, as I said, by next week worked out, and I'll make sure I mention those. But to the degree we get them before then, we'll be sharing them on the City of Montgomery Facebook page and on all outlets, our social media, as well as our website. When do we open? How will that work for the churches about being safe? When can we go again? And about how many can attend? It's a great question. Faith is so important to so many people here. And I think that the faith leaders have been instrumental in where we are right now. We didn't have some of the issues that you may have seen in other communities, in other states with our faith leaders. They really wanted to put the health of their parishioners at the forefront, and I'm grateful for that. I talked with many of them, and they all understood, and they've all tried to adapt by doing their services on Facebook Live or streaming them, or some type of service that allows people to still social distance, but still get the message of their faith. When will we reopen is going to be dependent on when the governor lifts her shelter-in-place order. Currently, it expires April the 30th, and we'll see what she decides to do after that. I do believe churches, like many other large places where we can have groups of people together, is going to be a phased-in approach. I think we have to be very cautious and conservative in what we do there. Again, I know we're all ready to get back to how things are used to being done, but we don't want to have a setback in our progress that we've made. So depending on what the governor says about her shelter-in-place order, when that is right now ends on April the 30th, we'll want to take a look at how we go about not only churches, but even entertainment establishments, groups and gatherings and festivals and things along those lines will also be impacted by that. So I don't have a date right now on churches and when they will open back up. I think we'll wait for the governor to make a decision on the shelter-in-place order, and then we'll try to move accordingly with that to the best we can. But I'm going to err on the side of caution here in Montgomery, as we've done from day one. And so if that means a little longer delay for us, then I'll talk with the faith leaders about that and explain my decision if that's what we come to. All right, Ms. Wilson, can you see that?
I see. As I mentioned earlier, one of the ways that we can motivate our students, it has to be a collaborative effort. Again, we're going to go back to our phenomenal parents here at MPS. They've been very receptive and responsive to our calls when we say we need you. So I would get with the parents, find out what works best for their child, and then implement that in such a way that the child is excited about logging on to receive their daily instruction online.
Thank you. Is there any way that homeless people can be tested for COVID-19? Right now, our goal is that, if anyone is suffering from symptoms, they can be tested. I'm not sure what the process is at some of our homeless shelters. So that's a question we'll need to find out and follow up with you on, and maybe post that to our website and to this forum. But I think what we want to make sure is that if anyone is exhibiting symptoms, they have access to that. Right now, whether you're homeless or not, we just haven't had the type of care that's needed in order to get people tested. And so we're trying to alleviate that through the tests that are coming to the state of Alabama through the Department of Public Health, but also to those organizations that have reached out to offer us and volunteer to give us those tests as well. So I'll check with our staff to see what those policies are at some of the homeless shelters, and we'll try to get that back to you and post that as well. We'll have that before the end of the day too. So that's not something that you have to wait on to find that out. Who's allowed to be tested? Well, you have to call and set up an appointment with any of the providers, and we'll list those that we have, like with the coronavirus care hotline that Baptist Health set up. You have to call and be tested. The same thing is there with the Walmart test as well, so that you can set up an appointment. But Walmart has reached out to us and told us they have plenty of capacity for anyone who is exhibiting symptoms or feel like they may be suffering from COVID-19. And we just have to make sure we get that information to you. And again, we'll post that information to this site as soon as we're done, so you'll have it. But anyone can be tested that is exhibiting symptoms, but you do have to have an appointment with that particular entity.
Okay, how long will the teachers be available to assist with assignments? We are going to work with the students. I believe the final day of school is going to be May the 21st. But as usual, teachers always go above and beyond. However, parents need to do all they can to try and meet the deadline. If you're experiencing any difficulties completing your child's assignment by the deadline, I believe the packets are due May the 7th. Please contact your child's school, and we have resources available that can assist you in completing the work. But as far as teacher availability, we're always available. Always.
The question is, why can't testing be a must for people that are working and who are going back into the workplace? That is a decision that employers have to make at this time. We aren't in a position where the government can mandate that your employer does that. But let me say this, I do think that's where we're headed. I do think, we're headed into a different realm of environment and work conditions. I think we'll see more teleworking. I think we'll see more staggered shifts. I think that we'll see different spacing in some of our workplaces. I think even the manufacturing industry is going to change because of what's happened at some of the meat processing plants in other parts of the country. So I think our economy is going to have to adapt to this. And although the government can't mandate that anyone test their employees right now, I think you're going to see more employers do that on their own because they don't want to have their entire operation be exposed to the COVID-19 virus. And it's something that it's going to take some time, but in my opinion, I believe we'll see this sooner rather than later. And just to give you an example, on one of the video conferences that we had with a number of other mayors across the country with the Bloomberg Harvard Cities Institute. There were health experts from Johns Hopkins Institute of Public Health, as well as the Harvard Kennedy School. And Bill Gates was the distinguished guest speaker. And he's been investing, tens of millions, if not hundreds of millions of dollars into health disparities and the WHO for many years. And he shared with us that he did not think we would see a vaccine before the summer of next year, and probably more like the fall of next year. So I think with that type of time frame, you're going to see employers try to be proactive in testing and finding out the health and wellness of the employees to make sure that everybody can work in a safe environment, feels comfortable doing whatever their work calls for them to do. So I think that's coming. All right, do we have any other questions? Okay. I think that we've done a pretty good job on the questions. So I want to thank everyone for submitting those. I know that we have questions about the curfew and whether or not that will be an issue. The curfew is not one that deals with the governor's shelter-in-place order. That's one issue that we have dealt with on a local level, and we will be looking at how we manage the curfew going forward from a health standpoint in this community. And again, we're going to look at the numbers, we're going to look at the data, and then we'll certainly talk with community leaders, and we'll hear from many of you about the prospect of the curfew and whether or not that has been helpful. Our early numbers told us it was helpful in stopping large gatherings in the evenings. And so it's something that, although it can be depicted depending on what side you're on, it's something that we'll continue to look at regardless of whether or not the governor extends her shelter-in-place order beyond April the 30th or not. And then I know people are also wondering about the city budget and how we're doing on that front. Again, as I mentioned before, the city operates on revenue that is brought in by taxes, rental taxes, lodging taxes for hotels, sales taxes. Those are things, business license fees. Those are things that really fund city government. And right now, we have taken a significant hit in March. We believe that the April numbers are probably worse than that, and we'll have a much better sense of that probably the first week of May. So we'll have to adjust. We've talked to the city council about that. We've talked to the cabinet officials here about that. And so we're going to have to adjust how we do business, much like many of you have had to adjust how you conduct your own houses and how you conduct your lives because of, the reduced pay that you may have gotten or, any other financial challenges that have come about because of this. But we're going to look for every way that we can to maintain the vibrancy and the progress of this city, but we're going to do it in a way that's financially responsible, in a way that doesn't expose us to any unnecessary risk going forward. So that's something I'm sure we'll be talking about in future Facebook Live town halls, and we'll look forward to really explaining that without boring you too much as we go forward. I want to be sure to remind you as well that the South is lagging behind in terms of our census feedback. I cannot express to you how important it is for Montgomery and anyone who's watching this to fill out their census form. You can go to 2020census.gov and fill out that form. It's very important that you go to that website, my2020census.gov, and fill out that information, because that dictates the amount of federal dollars that we get as a city, as a community, to our educational system, to our healthcare system, and to even our infrastructure. When we talk about expanding Wi-Fi, broadband access, all of those things are a product of your population. Let me give you a quick example. The stimulus plan that many of you have heard about that has come through the CARES Act is being dispensed through states based on population. So while the state of Alabama will get over $1 billion in stimulus money to be utilized to bring back our economies and revitalize our communities, that will be disseminated based on population. So if you don't count, then you don't get maybe the money that you would have gotten if there had been a more accurate count. So it's things like that that impact our ability to serve you and our ability to enact programs and initiatives that we think are needed here in Montgomery that are really based on people going online and taking 5 minutes out of their schedule to let people know how many people live in the house with them, your age, your race, background, your gender, all of those things are very important. So please share this and continue to encourage people while they're practicing social distancing, while they're listening to Club Quarantine and whoever the DJ may be, whether it's Babyface and Teddy Riley facing off, or if it's D-Nice or somebody else on the turntables. While you're doing that, or even while you're watching some more Montgomery guys get drafted tonight and over the weekend, fill out that census form. It's really important that we do that. It has a direct impact on the amount of federal dollars we get for everything that you can imagine. Head Start programs, our food programs and feeding programs, everything comes back to the numbers and everything comes back to our participation. So let's try to do a better job on that front as well as we can. Lastly, I want to thank our first responders who've been, again, doing courageous work. I want to thank all the medical professionals for the work they're doing in our hospitals, all of our restaurant and grocery store workers for doing the things they've been doing over these last few weeks. Our sanitation and street maintenance team has been fantastic throughout the storms, as well as our EMT and fire and rescue. We have so many people who have not taken a day off, who have not been able to binge watch a show or get caught up on old sports highlights, or even watch a book or read a book, watch a TV program or movie that they've been talking about seeing. We've had so many people who have been going, day to day, hour to hour, nonstop through this, that we really owe them a lot of our appreciation in what they've been doing. And many of them have gone beyond the call of duty. So we just want to highlight them and say thank you for the work that you've been doing. And we want to make sure that everyone is doing their part to take care of themselves. And I'll finish with this. Make sure not only that you look out for your family, but that you look out for yourself. It's important that regardless of your age or regardless of how healthy you think you are, that you take some time away from the 24-hour news cycle, that you put your phone down, you put your iPad down, and you get some peace and quiet amongst yourselves, and just to kind of decompress a little bit, whether that's taking a jog outside or even a walk around your neighborhood. That's just kind of getting some quiet time alone early in the morning and the evening. Make sure you disconnect a little bit just to keep your mental state where it needs to be. That's so important for all of us to do during this time, because not only are we dealing with a health challenge, but we're dealing with financial challenges. We're dealing with a change of how we care for one another, how we interact with friends, family, and loved ones. Check on those that are most vulnerable in our population, our seniors in our community. We got to make sure we are looking out for our neighbors as well. But take time out for yourself. Find that corner, find whatever it is that relaxes you, and try to go to that space every now and then so you can make sure you come out better than you were on the end of this. And we will get through it, but we want to make sure we get through it with you, and we get through it together with all of us being in a better place. So let's continue to work together. Let's continue to look out for each other, and we'll make sure that Montgomery and everyone that lives here and works here is in a better place when we get done with this. And we're going to have some announcements coming up real soon about some efforts that we've started here at the city, not only to help our businesses and to help those who are out of work, but also to help those who are out of place and who are having some challenges health-wise as well, to get back on their feet and stay in a positive stance right now. So again, I want to thank everyone for all that you've done in cooperating with us. Make sure you pass the word along. The economy is not open just yet. We're trying to get there. We're going to take steps to get there, but they're going to be deliberate. They're going to be intentional. We don't want to undermine our progress with this. So even my barbershops, all of you that I visited while I was campaigning, even the beauty salons, the same thing. Pray for my sons who may have me holding the clippers to their head this weekend as I try to give them and myself a haircut. So I warn you now, if I come on this next Friday and I have a hat on my head, you'll understand why, because that means my barbershop wasn't open and neither should yours. Hey, take care of yourself. Have a great weekend, and let's look out for one another.